Thank you, Mr. Speaker. Honorable Prime Minister, Deputy Prime Ministers, Ministers, Assistant Ministers, Honorable Leader of Opposition, Members of Parliament. Nisayan Ravinakasaka. This morning, I rise to discuss a very painful challenge plaguing our nation, that of domestic violence in our families. Over the weekend, we had 3 tragic deaths. 2 women lost their lives to partner violence. Saini Mere Tuinasakea, a civil servant from Langi Housing, and Karishma Chaudhary from Kerembula in Nandi, who was 8 months pregnant. I would like to offer my deepest condolences to the family who have lost their loved ones. Mr. Speaker, with your permission, may I ask that we observe a few moments of silence for those who lost their lives in domestic violence.
Thank you. I agree to the request from the Honourable Minister. I would request for the members of Parliament and those in the gallery to stand and observe a moment of silence in honor of the 3 women. Thank you. You may be seated. Honourable Member, please continue.
Thank you, Mr. Speaker. Mr. Speaker, one other victim was found severely injured at a flat, while 2 more women and a man were injured through stabbing incident in Lodala Beach. Productive lives have been extinguished and 6 children have lost the care of their parents and have been emotionally scarred for life this past weekend. Each of these incidences were avoidable, Mr. Speaker. These are the cases of tragedy we know. Each day, there are many cases of domestic violence, and most go unreported. Mr. Speaker, while the global average is 1 in every 3 women, 2 in 3 women in Fiji face violence in the hands of their partners. In 2024, Dr. Lide Saurarao Vaningi undertook a study in Nandi, screening for domestic violence at Nandi Maternity Antenatal Clinic. Between March to June 2024, 345 women who were attending the clinic and participated in the study, 247, that's 71.6% of women said they had experienced domestic violence in their lifetime. 13% experienced physical violence during pregnancy, Mr. Speaker, and husband and partner was the most common perpetrator of this physical violence. Domestic violence carries a significant economic cost estimated at around staggering 300 million annually. That's 7% of Fiji's GDP. This amount includes medical services and related government services. Then there is grief, fear, emotional scarring for life for not only the victim, but also other members of the family involved, often children who witness and suffer violence with their mothers. According to Fiji police statistics, the Western Division topped the numbers at 37 to 40% of all reported cases of domestic violence against women and around 35% of cases of violence against children in the past 5 years. Eastern Division reported around 17 to 18%, Northern Division around 11%, and Central Division recorded 3.3% of all cases in 2024. These are not necessarily the true reflection because many cases may be going unreported each year. Mr. Speaker, there is always criticism that government is not doing enough to curb the situation. Mr. Speaker, we have a national plan on prevention of domestic violence against women and girls. Government has acknowledged a high prevalence of gender-based violence and is now focusing on strengthening tertiary, secondary, and primary prevention approaches aiming to stop violence before it happens. Fiji has boldly called out patriarchy as the root cause of violence. This is our commitment to reviewing systems and structures that contributes to high rates of violence against women and children. It is also an opportunity to harness the strength of social systems to bring about transformational change in the lived realities of women and girls. Fiji's National Action Plan to Prevent Violence Against Women and Girls, launched in 2023, was developed in collaboration with our civil society organizations, women feminist groups, and faith-based organizations, using a whole-of-government, whole-of-society approach with an emphasis on stopping violence before it starts. Now, in its second year of implementation, the Secretariat chaired by our ministry with Fiji Women's Crisis Center, Fiji Women's Rights Movement, House of Sara, and Diva for Equality, and the UNFPA is currently driving the implementation of the National Action Plan across 7 prioritized settings, including health, sports, faith settings, education, traditional and informal settings. The education and traditional settings have been very progressive, Mr. Speaker. Ministry of Education progressed work in mapping initiatives by building comprehensive social, emotional skills for healthy, non-violent, gender equal, respectful, and safe relationships among primary and secondary schools, including the UNFPA's Family Life Curriculum. In our traditional setting, following a number of high-level dialogues with traditional leaders, the Ethoke Affairs Great Council of Chiefs Amendment Regulations 2024, effective in December 2024, now includes advocacy to address violence against women and children as one of the 12 strategic directions set for the Great Council of Chiefs. Under the traditional setting, traditional leaders have agreed to not only look at the prevalence of violence amongst the Ethoke within the traditional boundaries, but also look at the Ethoke living in informal settlements outside the traditional boundaries and strategizing to bring about services and suitable approaches to prevent violence against women and children. Our ministry is reaching out to informal settlements through the Rights Empowerment and Cohesion Program known as REACH program. We are setting up women's forums in districts starting with Central and Western divisions. The intention is to reach out to every community and assist in developing support groups and prevention committees to identify, de-escalate, and prevent violence from happening. In November last year, in collaboration with UNICEF, we engaged Dahlberg Advisors firm to carry out much-needed rapid attitude survey for the NAP. The focus of the survey is to identify and understand the attitudes and violence against women and children, and we are hoping to complete this survey by June this year. Mr. Speaker, government has put legislations in place, funds social protection, and counseling through the NGOs. There are 24/7 national toll-free lines 1560 and 1325. We have service delivery protocol for responding to gender-based violence. Police, judiciary, health professionals, and social services have standard operating procedures for interagency response. The service protocols are under review to include additional stakeholders as well. But, Mr. Speaker, these services are provided at the end of the cliff, when the violence has scarred lives already. We need to change attitudes around domestic violence and break down patriarchal structures around our society. Mr. Speaker, domestic violence in family and community setting Mr. Speaker, the violence occurs in family and community settings and needs action from all segments of the society, our families, our elders, our faith-based organization, and men taking responsibility for their actions. Mr. Speaker, a pertinent question being asked by every woman in this country is, why do 2 out of 3 men in this country think it's okay to mistreat their partners? When men are in argument with other men, do they use violence? No. Then why do they use violence against someone who stands by them thick and thin? Why is it okay to break promise of love and care? How is it acceptable to breach trust of their loved ones to cause grief, anxiety in their partners and their children? How can we as a society justify such behavior from our men? What can we do to hold abusive partners accountable? Do we call out our friends and family members we know are abusive to their family members? We need men not to be bystanders but allies and call out this behavior when they see this. So I call on faith leaders and community leaders to create spaces to have these conversations with men, to promote respectful relationships and create awareness on how violent actions destroy relationships and emotionally and physically scar those who have placed their love and trust in these men. Mr. Speaker, it's gut-wrenching to see some of the children in our state homes who are victims of such incidences, completely displaced and lost in life. They don't have their parents or family members who take care or guide them in life. We owe it to our children to stop the carnage, Mr. Speaker. Today is Thursday, a day dedicated to Thursdays in Black campaign, a global initiative supported by World Council of Churches to raise awareness and protest against violence and abuse against women and children. Let's do more than wearing of black every Thursday. Let's work on changing attitudes and practices that enable family violence. We, as a nation, have to commit to zero tolerance for all forms of violence, and I appeal to this House, to faith leaders, to employers, to family elders, to open these conversations and commit to zero tolerance to violence in our homes and our communities. Mr. Speaker, we have it in our powers, within our powers, to halt this malice from growing if we commit to taking action. For those women who may be in abusive relationships, help is available through our toll-free lines, 1560 and 1325, that are government-funded helplines managed by Fiji Women's Crisis Center and Medical Services Pacific, respectively. I also request media and social media users to be sensitive in the way we speak about victims and their family. While we need to provide support, let's respect the need to grieve in privacy. Mr. Speaker, domestic violence leads to physical and psychological harm, financial instability, and reduced productivity, impacting the overall well-being of Fijian communities. Addressing this issue is essential for promoting human rights, creating safer communities, and fostering sustainable development. Mr. Speaker, the government remains committed to preventing all forms of violence against women and girls through targeted policy action across sectors and government ministries, and I urge all of us to work together to take responsibility to stop this carnage. Thank you, Mr. Speaker.